What calls require a cardiac monitor? VSA, LOA part, syncope, sob, chest pain, overdose, abnormal vital signs. What is the minimum time that you can monitor vitals at? Q 30 minutes. The paramedic shall carry out emergency treatment on an incapable person if A part does not have capacity. B part experiencing severe suffering. C a delay to get consent will prolong suffering. The paramedic shall carry out emergency treatment on a capable person if A part is at risk/severe suffering. B language barrier. C means taken to communicate but ineffective. When completing a patch, what information has to be included? Unit number, part age, part sex, CTS level, CC, pertinent assessment findings, part management, abnormal vitals, ETA. In the oxygen standard, what is the range do we want to maintain SpO2 at? 92 to 96%. What are some conditions that we want to administer high concentration oxygen in the oxygen standard? A suspected CO exposure. B upper airway burn. C scuba diving disorder. D cardiopulmonary arrest. D complete airway obstruction. If SpO2 monitor is not working, what signs are we looking for to administer high concentration oxygen? A hypotension. B abnormal pregnancy. C cyanotic/pale. D respiratory distress. C altered LOA. What is the special criteria outlined in the trauma field triage standard? A H. B bleeding disorders. C burns. D pregnancy greater than 20 weeks. According to the spinal motion restriction standard, what MOIs should you consider SMR? A trauma associated with head or neck pain. B sports accident. C diving injury. D submersion. E falls. F electrocution. I penetrating injury to the head, neck or torso. What does a DNR not allow us to do in an event of cardiopulmonary arrest? A CPR. B artificial ventilation. C defibrillation. D resuscitation drugs. E transcutaneous pacing. F insertion of OPAG. Intubation. What is deemed obviously dead? A grossly charred body and VSA. B decapitation, transection, visible decomp and putrefaction. C open head/torso with outpouring of contents and VSA, dependent lividly and VSA, gross rigor mortis and VSA. When can a paramedic restrain a part who is violent? A under police authority. B under DR authority. C part in ambulance becomes violent en route. When should escorts be used in the IV maintenance standard? A blood products. B narcotics. C infusion rates greater than 200 milliliters per hour. D central lines. E potassium chloride to a part under 18 Fahrenheit. Pediatric part under 2 years. G electronic pumps. When should an IV bag be changed? 150 milliliters of solution remaining in bag. What conditions should we consider in the non-traumatic abdominal standard? AAA, ectopic pregnancy, testicular torsion, acute pancreatitis, obstruction, pelvic infection, hernia. According to the general geriatric standard, what are activities of daily living? A bathing. B transferring. C toiling. D eating. E dressing. What are some conditions that you can consider leaving on the first analysis according to the medical cardiac arrest standard? A pregnancy of 20 greater than weeks, B suspected pulmonary embolism, C hypothermia, D overdose, E airway obstruction. What is the mandatory patch point state in the medical cardiac arrest standard? Patch to BHP for TOR after third analysis. If patch fails or TOR does not apply, transport to closest facility following ROSC or fourth analysis. If a part makes informed refusal of service, and was hypoglycemic, what has to be completed on the ACR prior to being departed? Final set of vitals and BGL. What is the minimum volume for nebulization? 2.5 milliliters. What are the symptoms that are consistent with the onset of acute stroke protocol? A. Inappropriate words or mute, B. slurred speech, C. unilateral arm weakness or drift, D. unilateral facial droop, E. unilateral leg weakness. What are contraindications for the stroke bypass protocol? A. CTS1-bit stroke symptoms resolved prior to paramedic arrival, C. BGL under 4, D. GCS under 10, E. seizure at onset or observed by paramedics, F. terminally ill palliative care, PTS. If stroke symptoms persist after correction of blood glucose, is the part contraindicated out of the stroke bypass protocol? No. What are the following indications for STEMI bypass? A part is greater than 18 years of age, B. chest pain related to cardiac ischemia, C. chest pain for less than 12 hours, D. 12 lead shows a STEMI or. What are contraindications for the STEMI bypass? A 12 lead shows LBBBB part is CTS1C, transport time is 60 minutes, DPCP diversion such as CPAP, VSA, or becomes symptomatic, BP under 90. Should a paramedic apply defibrillation pads once a STEMI has been confirmed? Yes. Sepsis is suspected by the following: a fever of 38.5 greater than B, potential infection site, C. presence of any of the following: SBP less than 90, RR22 or greater, acute confusion. Following the guideline outlined in the respiratory failure standard, if using ETCO2 on a COPD or asthma part, and they have an initial ETCO2 of 50 greater than, what should we attempt to maintain their ENCO2 value to? Between 50 to 60 mmHg. How much blood can a normal size tampon hold? 5 milliliters. What are splinting priorities? 1 spine, 2 pelvis, 3 femurs, 4 lower extremities, 5 upper extremities. According to the blunt/penetrating injury standard, how long are we irrigating bite wounds for? 5 minutes. According to the head injury standard, what ETO2 value should we attempt to maintain? 35 to 40 mmHg. When should we hyperventilate a part with signs of cerebral herniation? If measures were already taken to improve hypoxemia and hypotension and to target ETCO2 levels between 30 to 35 mmHg. What are signs of cerebral herniation? 1 dilated not reactive pupils, 2 asymmetric pupil response, 3 asymmetric motor response, 4 posturing. According to the head injury standard, if ETCO2 is not available, what rate should we hyperventilate adult, child, and infant? Adult 20 breaths per minute, child 25 breaths per minute, infant 30 breaths per minute. If the part is presenting with cerebral herniation and is on a spinal broad, what can we do? Elevate 30 degrees. If the presence or absence of shivering with altered level of consciousness is observed, what should we assume the core body temp to be according to the cold injury standard? Below 32 degrees. If the part is experiencing mild to moderate hypothermia, what treatment should be done? 1 foil rescue blanket to rewarm with hot packs to axillary, groin, and cervical region. If the part is experiencing severe hypothermia, what treatment should be done? 1 foil rescue blanket to careful use of sectioning. According to the extremity injury standard, if a fractured or injured extremity is found pulseless or angulated, what action should we take? To gently pull traction unless severe pain or resistance is encountered. True/false: if an injury affects a joint, we should always splint below the injury. False. What should we do in cases of open fractures? 1. Clean site with normal saline to apply moist sterile dressings on site. According to the hazardous materials standard, how long should we irrigate an alkaline burn for? Approximately 20 minutes. How long should we irrigate an unknown chemical burn for? Minimum 20 minutes. According to the extremity injury standard, both open and closed femur fractures should be treated using a traction splint. Yes. According to the pregnancy standard, when should preeclampsia be assumed? Part is beyond 20 weeks with a BP of 140/90 or greater, with edema or complaints of headaches, nausea, abdominal pain, blurred vision, fatigue, vomiting. When should an APGAR score be completed? 1 minute and 5 minutes post-delivery. What does APGAR stand for? Appearance, pulse, grimace, activity, respirations. According to the neonate standard, when should paramedics initiate rapid transport? If the 5 minutes post-APGAR score is less than 7. Going down the CRU protocol, how much AP should be given to a 10 kg part that is 9 months old? 2.5 milligrams. What are causes of croup? Parainfluenza virus, RSV, influenza A and B. Going down the glucagon protocol, how much glucagon is given to a 8-year-old part? 1 milligram. What is a trauma TOR? Age 16 greater than, LOA is altered and no palpable pulses and no shocks delivered, and HR is monitored at 0 or HR is above 0 and transport time is greater than 30 minutes away. What is the medical TOR? Age 18 greater than, LOA altered and arrest not witnessed by EMS and no shocks delivered and no ROSC. Electronic probe removal is contraindicated by probes being above the clavicles or nipples or genital area. What is A in phonetic alphabet? Alpha. What is B in phonetic alphabet? Bravo. What is C in phonetic alphabet? Charlie. What is E in phonetic alphabet? Echo. What is D in phonetic alphabet? Delta. What is F in phonetic alphabet? Foxtrot. What is G in phonetic alphabet? Golf. What is H in phonetic alphabet? Hotel. What is I in phonetic alphabet? India. What is J in phonetic alphabet? Juliet. What is K in phonetic alphabet? Kilo. What is L in phonetic alphabet? Lima. What is M in phonetic alphabet? Mike. What is N in phonetic alphabet? November. What is O in phonetic alphabet? Oscar. What is P in phonetic alphabet? Papa. What is Q in phonetic alphabet? Quebec. What is R in phonetic alphabet? Romeo. What is S in phonetic alphabet? Sierra. What is T in phonetic alphabet? Tango. What is U in phonetic alphabet? Uniform. What is V in phonetic alphabet? Victor. What is W in phonetic alphabet? Whiskey. What is X in phonetic alphabet? X-ray. What is Y in phonetic alphabet? Yankee. What is Z in phonetic alphabet? Zulu. What is 10-3? Radio silence. What is 10-4? Received message. What is 10-6? Busy. What is 10-7? In service. What is 10-8? Out of service. What is 10-9? Repeat. What is 10-13? Friend/relative nearby. What is 10-19? Back to base. What is 10-20? Location. What is 10-21? Call on phone. What is 10-25? Nonviolent psych part. What is 10-26? Call cancelled. What is 10-36? Emergencies closed. What is 10-37? Emergency is only open to code 3s. What is 10-100? Bomb threat. What is 10-50? Violent psych part. What is code 1? Deferrable transfer. What is code 2? Scheduled transfer. What is code 3? Prompt. What is code 4? Urgent. What is code 5? Obviously dead. What is code 6? Transport of a dead body. What is code 7? No park carry. What is code 8? Standby. What is code 9? Out of service. What is code 72? Refusal of service. What is code 76? Cancelled before scene. What is code 73? Part expired. What is code 74? Part in police custody. What are the elements of informed consent? 1. Consent is voluntary. 2. Consent is about treatment. 3. Consent is informed. 4. Consent cannot be attained. Fraud/misrepresentation. In the cases of part with a DNR, what palliative care treatment can paramedics give? A. Oxygen. B. Nitro. C. Glucagon. D. Salbutamol. E. AP for anaphylaxis. F. ASAG suctioning. What is ASA and how does it work? It is an SID and antiplatelet, and works by inhibiting COX-1 and 2 as well as thromboxane A2 that prevents coagulation. What is nitroglycerin? It is a vasodilator and acts on the dilation of smooth muscle of all vessels in the body. What is epinephrine, and how does it work? It is an adrenergic drug that stimulates the flight or fight reaction by acting on alpha and beta receptors, causing increase of cardiac output, bronchodilation, dilated pupils, and vasoconstriction of mucosal membranes. What is diphenhydramine, and how does it work? It is an antihistamine and anticholinergic that works by inhibiting histamine H1, which reverses the effects of histamine release and past the blood-brain barrier, causing sedative effects. What is dimenhydrinate, and how does it work? It is a mix of diphenhydramine combined with 8-chlorothophylline and is taken for motion sickness as well as nausea and vomiting. What is salbutamol and how does it work? It is a short-term beta-2 receptor agonist that causes the smooth muscle of the bronchi to expand in diameter, thereby increasing lumen size. What is naloxone and how does it work? It is a competitive short-acting opioid receptor antagonist that binds to opioid receptors and blocks the effects of opioid agonists. What is glucagon, and how does it work? It is a peptide hormone that works by increasing glucose in the bloodstream by breaking down glycogen stores in the liver. What is ketorolac and how does it work? It is an SID that works as a non-selective COX inhibitor, inhibiting prostaglandins, thereby reducing pain, fever, and inflammation. What is acetaminophen, and how does it work? It is used to treat pain and fever and reducing COX activation in the CNS. What is ibuprofen, and how does it work? It is an SID that inhibits COX and prostaglandin synthesis, reducing pain, fever, and inflammation. What is the normal blood pH of a human being? 7.35 to 7.45. What are buffers relating to pH regulation? Mechanisms that the body uses to control the pH balance when pH levels get too high or low. What are the three different kinds of buffering systems? Protein buffering, bicarbonate buffering, and physiological buffering. What is the intracellular buffering? Using proteins and phosphate to stabilize pH intracellularly. What is extracellular buffering and how does it work? Carbon dioxide, a byproduct of cellular respiration, is dissolved in the blood, where it is taken up by red blood cells, and converted to carbonic acid by carbonic anhydrase. Most of the carbonic acid then dissociates to bicarbonate and hydrogen ions. What two systems are in control of physiological buffering? Pulmonary system and renal system. What system controls the level of carbonic acid? Pulmonary system. What system controls the bicarbonate levels in the body? Renal system. What is respiratory acidosis? It is when the CO2 levels build up in the blood and mixes with water in the lungs to create excess levels of carbonic acid. What are causes of respiratory acidosis? COPD, head injury, asthma, overdoses, chest trauma. What is respiratory alkalosis? When too much CO2 is being exhaled and causes the pH to increases beyond 7.45. What causes respiratory alkalosis? Head trauma, fever, salicylate toxicity, anxiety. What is metabolic acidosis? When too much H+ ions are not being secreted and building up in the body, decreasing pH. What causes metabolic acidosis? Diabetic ketoacidosis, ingestion of salicylates, renal failure, lactic acidosis, hypoxemia. What is metabolic alkalosis? When there is too much bicarbonate in the body that causes a pH increase. What causes metabolic alkalosis? Overuse of diuretics, ingestion of sodium bicarbonate, excessive vomiting and diarrhea. What is the normal ratio of carbonic acid to bicarbonate? 1:20. What are the 4 parts of the brain? Cerebellum, cerebral cortex, diencephalon, brain stem. What parts make up the brain stem? Midbrain, pons, medulla oblongata. What does the midbrain control? Visual reflexes and movement control. What does the pons control? Acts to control breathing and swallowing. Explain the reticular activating system. 2 neural tracts that are responsible for the level of alertness and sleep and wake cycles. What does the medulla oblongata control? Heart rate, blood pressure, breathing, and controls vomiting. What does the pineal gland secrete? Melatonin. What makes up the diencephalon? Epithalamus, thalamus, hypothalamus. What are the different layers of the meninges from outer to inner? Dura, arachnoid, pia. Where is CSF produced? Choroid plexus of the 3rd and 4th ventricle. What is the purpose of CSF? To circulate fluid that protects, clears waste, and moves substances into brain cells. What is bacterial meningitis? When bacteria infect the meningeal layers and cause infection and inflammation in the brain and spinal column and can cause increased intracranial pressure. How many cervical vertebrae does a human have? 7. How many thoracic vertebrae does a human have? 12. How many lumbar vertebrae does a human have? 5. What is an action potential? Electrical impulse. The cardiac action potential can be divided into 5 phases. What are these phases? 0 equal rapid depolarization, 1 equal early rapid repolarization, 2 equal plateau phase, 3 equal terminal phase of rapid repolarization, 4 equal repolarization complete. What is depolarization? The action of sodium channels opening. What is repolarization? The action of potassium channels opening and sodium channels closing. How does the sodium-potassium pump work? Occurs after repolarization and pumps 3 sodium to the extracellular space for every 2 potassium intracellularly. What are the 2 pathways that the nervous system uses to relay messages? Afferent and efferent. Where on the spinal cord does sensory information enter? Dorsal horn. Where on the spinal cord does motor response enter from? Anterior horn. What does parasympathetic activity stimulate? Pupil constriction, increased gastric mobility, bradycardia, increased in secretion, bronchoconstriction. What do muscarinic M1 receptor do for the parasympathetic system? Acts to increase secretion of salivary glands, stimulate bronchoconstriction, and gastric acid secretion. What do muscarinic M2 receptor do for the parasympathetic system? Located in the heart and acts to bring the intrinsic rate down. What do muscarinic M3 receptor do for the parasympathetic system? Acts to cause bronchoconstriction, and acts on the detrusor muscle that causes bladder contraction. What does sympathetic activity stimulate? Dilated pupils, tachycardia, increase in lipolysis from fatty acids, increased diameter in coronary and skeletal vessels, vasoconstriction of vessels of the gastric tract/skin, decrease in gastric motility. What are the 2 ways that the body carry messages to and from the brain? Electrical impulse and neurotransmitters. What is a neurotransmitter? It is a chemical that is released at the end of an axon terminal that crosses the synapse to carry a message to another cell. What neurotransmitter is responsible for parasympathetic activity? Acetylcholine. What neurotransmitter is responsible for sympathetic activity? Epinephrine and norepinephrine. What kind of actions do alpha-1 receptor produce and where are they located? They produce effects that cause vasoconstriction in the blood vessels when stimulated and are located on the postsynaptic. What kind of actions do alpha-2 receptor produce and where are they located? They produce effects that inhibit norepinephrine release in the CNS and certain vessels which causes vasoconstriction and sedative affects and are located on the per- and postganglionic. Where are epinephrine and norepinephrine released? They are released from the adrenal medulla. What does norepinephrine do for the human body? In the brain it increases alertness and increased vigilance, and in the body increase BP, HR, and glucose uptake. What is the largest and strongest bone in the body? femur. What are osteons? They are the formation of osteocytes that warp around a Harvation canal. What are Harvation canals? They are canals inside bone where they supply blood and nerve supply to surrounding bone osteocytes. What is bone remodeling? Occurs when new bone replaces old bone, and with the use of gravity and deposits of calcium salts. What are osteoblasts? Bone-forming cells. What are osteoclasts? Break down bone cells. What is the bone healing process that occurs after a fracture to a bone has occurred? 1. Hematoma. 2. Fibrocartilage. 3. Bone callus. 4. Remolding. What occurs during the fibrocartilage stage of the healing bone fracture? Fibrocartilage forms as well as new blood vessels and form a cartilage callus. What occurs during the bony callus stage of the healing bone fracture? The fibrocartilage is replaced by spongy bone. What is peritoneum? Is dense irregular tissue that forms on bones expect at the ends of long bone. What is the diaphysis? Long shaft of the bone. What is the epiphysis? Ends of the long bone. What is the epiphyseal plate? Growth plate. What is ossification? Process of bone formation when hyaline cartilage is replaced and the bone grows and widens. What are the 3 structural classifications of joints? Fibrous, cartilaginous, synovial. What are the 3 functional classifications of joints? Synarthros movable, amphiarthros slightly movable, diarthros freely movable. Name 6 types of synovial joints. Plane, hinge, pivot, ball, and socket, condyloid, saddle. What is the appendicular skeleton? Comprises bones of the shoulder girdle, pelvic girdle and lower/upper extremites. What is the axial skeleton? Comprises bones of the skull, ribcage, and the vertebral volume. What is hematopoiesis? Formation of blood cellular components. Where does hematopoiesis occur in infants? In the medulla of long bones known as red bone marrow. Where does hematopoiesis occur in adults? Pelvis, vertebral column, and cranium. What is a pathogen? An microorganism that causes disease or illness. What are different kinds of agents? Bacteria, virus, fungus, protozoa. What does eukaryotic mean? A pathogen with a true nucleus. What does prokaryotic mean? a pathogen without a true nucleus. What are some ways of transmission of pathogens? Airborne, skin contact, ingestion, contact with fluids. What are ideal conditions that encourage pathogens to grow? pH level, temperature, food, water. What are antibiotics given for? Bacterial infections. What is the chain of elements? Pathogenic agent reservoir portal of exist, environmental transmission of agent portal of entry susceptibility. What does sterile mean? Free from any living microorganism. What is isolation? Using proper BSI to protect yourself from the patient. What is reverse isolation? Using BSI to protect the patient from you. What is the effectiveness of the N95 mask? 95%. What is Staphylococcus aureus? A common bacteria found on the skin. What bacteria is the most common causes of skin infections and can cause fatal infections if they get into the bloodstream? Staphylococcus aureus. What is VRSA? Vancomycin-resistant Staphylococcus aureus. What is MRSA? Methicillin-resistant Staphylococcus aureus. What is C. difficile? A bacterium that releases toxins A and B that destroy normal healthy cells in the small bowel and causes severe diarrhea. What causes C. difficile? Use of certain antibiotics that allow levels of healthy gut bacteria to decrease. What are some variables involved in the outcome of a host becoming inoculated by a pathogen? 1. Route of entry. 2. The strength of the pathogen. 3. The quantity of the pathogen. 4. The immunity of the host. What are the stages to infections disease? 1. Latent stage. 2. Incubation stage. 3. Communicability stage. 4. Disease stage. What does anaerobic mean? Without oxygen. What does aerobic mean? With oxygen. What does aseptic mean? Clean and without infection. What is flora? Microorganisms that inhabit the body and do not cause infection under normal conditions. Where is flora found? Skin, GI tract, stool, mouth. What is a bacteria? An organism that infects the body and releases toxins. What is a virus? Contain a core with DNA or RNA and invade host cell and trick the cell into producing nucleic acids from the virus DNA or RNA. What is protozoa? Eukaryotic single-celled microorganisms. What does the urinary system regulate in respect to hemostasis? Water balance, pH, electrolytes, blood pressure, red blood cell formation, acid-base balance, activation of vitamin D. What is the renal capsule? Surrounds each kidney. What does the adipose capsule do in relation to the kidney? Fatty tissue helps protect and keep the kidney in the right place. What are the three regions of the kidney? Renal cortex, renal medulla, and renal pelvis. Blood flow to the kidneys. Aorta greater than renal artery greater than segmental artery greater than interlobar artery greater than arcuate artery greater than interlobular artery greater than afferent arteriole greater than glomerulus greater than efferent arteriole greater than perivebular capillaries greater than interlobular vein greater than arcuate vein greater than interlobar vein greater than renal vein greater than inferior vena cava. What parts make up the nephron? Glomerulus and renal tubule. What are the two types of nephrons? Cortical nephron and juxtamedullary. What is the difference between the cortical nephron and the juxtamedullary nephron? The cortical nephron is located in the cortex only, whereas the juxtamedullary nephron is located at the boundary of the cortex and medulla. Explain the filtration process within the kidneys. A non-selective process where water and solutes pass through glomerulus capillaries and into the renal tubule. Explain reabsorption within the kidneys. The perivebular capillaries reabsorb minerals from the renal tubule such as glucose, ions, water, amino acids. Where does most reabsorption happen within the renal tubule? The proximal convoluted tubule. Where is the bladder located? Behind the symphysis pubis. What is the detrusor muscle? The smooth muscle around the bladder. What is the trigone relating to the bladder? 3 openings. What are abnormal substances found in the urine? Albumin, glucose, blood cells, ketones, microbes. What is reabsorption controlled by? Aldosterone and ADH. What is the thirst mechanism? Osmoreceptors in the hypothalamus are sensitive to plasma solute concentrations and activate thirst when plasma solute increases. Where is the location of the kidneys? At the level of T12 to L3. Is blood considered connective tissue? Yes. What is hypokalemia caused by? Use of diuretics or laxatives, starvation, eating disorders, prolonged vomiting, kidney failure where the kidney excrete too much potassium. What are complications of hypokalemia? Cardiac arrhythmias, muscle cramping and weakness, extreme thirst, frequent urination. What is the lab value for hyperkalemia? above 5 mg/dl. What is the lab value for hypokalemia? Below 3.5 mg/dl. What is hyperkalemia? A condition where there is too much potassium in the extracellular space. What is the most worrying symptom of severe hyperkalemia? Suppression of electrical activity in the heart. What are ECG signs that might indicate that hyperkalemia is present? Tall peak T waves with shortening of the QT interval to eventually no P waves, and then widening of the QRS. What are functions of blood? A transport nutrients, B transport O2, C distributing body heat, D transporting wastes, E transporting wastes, F assists immune system response. Is blood temperature slightly lower than body temperature? No. Slightly higher than body temperature. What makes up plasma? Hormones, water, salts, proteins, wastes, glucose. What is the buffer layer of the blood? Contains leukocytes and platelets. What are formed elements within the blood? Erythrocytes and thrombocytes. Where are plasma proteins produced? Liver. What is erythropoietin and where is it released from? Hormone that is released from the liver and stimulates RBC production. How many binding sites does hemoglobin have? 4 binding sites. What is the lifespan of RBC? 120 days. What are the 5 types of white blood cells? Neutrophils, lymphocytes, monocytes, eosinophils, basophils. What do neutrophils do? Phagocytic. What do basophils sow? Release heparin and histamine. What do monocytes do? Large phagocytes. What is blood cell formation called? Hematopoiesis. What is a hemocytoblast? Blood-forming cell where all formed elements come from. Hemocytoblasts can form 2 types of descendants: myeloid stem cells and lymphoid stem cells. What do myeloid stem cells form? RBC, platelets, basophils, eosinophils, neutrophils, monocytes. What do lymphoid stem cells form? Lymphocytes. The 3 stages of hemostasis. Vascular spasms cause vasoconstriction, platelet plug forms utilizing collagen fibers, coagulation when the clotting factors interact with calcium. What are the different types of blood groups? AB, A, B, O. What blood group is the universal recipient? AB+. What blood group is the universal donor? O. If a person has type B blood with a B antigen on the RBC, what antibody will be produced? A. Antibodies. If a person has AB blood and AB antigens, what antibodies will be produced? None. What is the Rh factor? Can be either, or plus and reflects the presence of an antigen of the surface of the red blood cell, plus means there is an antigen where, means there is no antigen. What makes up the pericardium? Fibrous and serous membrane. What are the three layers of the heart wall? Epicardium, myocardium, endocardium. What tissue makes up the epicardium? Connective tissue. What atrioventricular allows blood to flow from the right atrium to the right ventricular? Tricuspid. What atrioventricular valve allows blood to flow from the left atrium to the left ventricle? Bicuspid. When do the atrioventricular valves open? Distal. What vessel enters the right atrium from systemic circulation? Vena cava. Where does the coronary sinus empty into? Right atrium. For the heart to beat, there must be a nerve impulse sent from the nervous system. No. The intrinsic system of the heart can generate their own electrical impulses. When do the coronary arteries fill with blood? Diastole. The heart is made up of two different cells. What are they? Autorhythmic cells and contractile cells. True/false, do autorhythmic cells contract? False, they start action potentials. What is enhanced automaticity? An increase in the depolarization period caused by excess leakage of sodium ions into the cell. What are reasons for enhanced automaticity? A. Digitalis toxicity, B. Hypoxia, C. Hypokalemia, D. Increased perload, EMIF, excess catecholamines. What is stroke volume? The amount of blood pumped out of the ventricles during one contraction. What is heart rate? Amount of times the heart contracts in 1 minute. What is Darling's law? The strength of each contraction increases with the stretch of the ventricles. What are the three openings into the right atria? Superior vena cava, inferior vena cava, coronary sinus. How much blood can a healthy heart pump out of the ventricles? 60%, 70 milliliters. What big factor will cause a decrease in stroke volume? Decrease per load. What is the intrinsic rate of the SA node? 60 to 80 bpm. What is the intrinsic rate of the AV node? 40 to 60 bpm. What is the intrinsic rate of the ventricles? 20 to 40 bpm. On a 12 lead, which leads are septal? V1, V2. On a 12 lead, which leads are anterior? V3, V4. On a 12 lead, which leads are inferior? Lines, LLL, of F. Which artery supplies the inferior wall of the left ventricle in most humans with blood supply? Right coronary artery. The left coronary artery branches off into what two separate arteries? Circumflex and left anterior descending. What part of the heart does the circumflex feed? Lateral and posterior left ventricle. In total, what parts of the heart does the right coronary artery supply blood to? Right ventricle, posterior wall, inferior left ventricle. What are common signs for women having an AMI? Sob, nausea, vomiting, back pain, general malaise. What does a left bundle branch block look like? A wide QRS with peaked R wave in a downward position. What does a right bundle branch block look like? A wide QRS with peaked R wave in an upward direction. What does pericarditis look like on a 12 lead? Concave ST elevation in all leads. What is pericarditis? Inflammation around the fibrous sac around the heart. What are common symptoms for pericarditis? Sudden onset of chest pain, sharp pain, worse on inspiration, less pain when sitting forward, fever if viral infection. What are common causes of pericarditis? HIV, viruses, kidney failure, systemic lupus erythematosus, hypothyroidism. What causes angina? Narrowing of the coronary arteries from atherosclerotic disease reduces blood flow to an area of the heart. What is stable angina? A person might have chest pain when moving around, but when they rest or take medication the pain goes away. What is unstable angina? The person experiences chest pain with minimal movement or at rest, but it does not go away with rest or medication use, and the chest pain is more severe with past history of increasing frequency of angina-like pain or medication use. What population does AAA affect the most? White males in or past their 60s. What causes AAA to occur? Weakened muscle layer on the artery bulges in size as pressure from the heart pumps blood, and as the bulge grows it can rupture, causing death. What are classic signs of AAA? sharp back pain, unexplained groin back, pulsating mass, hypotension. Left ventricular hypertrophy can be caused by systolic overload or diastolic overload. A patient with unstable PSVT might display what symptoms? Hypotension, altered awareness, severe chest pain, sob. Prolonged PSVT may lead to a generalized myocardial infarction due to short chamber filling time because a loss of atrial kick leading to a decrease in cardiac output. What is sudden cardiac death? When the heart's electrical rhythm changes suddenly into an arrhythmia where the heart cannot pump anymore. True/false, can dilated cardiomyopathy cause blood clots to form? True. Since the left ventricle is weakened, blood pools in the ventricle, and can form a clot that could cause a stroke. What is a capillary? The smallest of blood vessels that are 1 cell thick and only have a tunic intima. What is a vascular shunt? Where an arteriole connects to venule. What is the equation to measure blood pressure? BP equals COXPR. Blood pressure can be controlled by what 2 factors? Neural factors, sympathetic division. Renal factors, aldosterone. What does the lymphatic system do? A filters bacteria and toxins by fluid regulation. What is edema? Fluid left in the interstitial space. How many afferent vessels are going to the lymph node? 4. How many efferent vessels are going to the lymph node? 2. What are found in the lymph node medulla? Plasma cells and monocytes. What are found in the follicles of the cortex of the lymph node? B cells. Where are the main sites of lymph nodes? Cervical, axillary, and inguinal. What is the RAS system? Renin-angiotensin-aldosterone system. What part of the kidney senses changes in blood pressure that releases renin? Juxtaglomerular apparatus. Where is angiotensinogen released from? Liver. Stimulus/stimuli for renin secretion include what happens when renin and angiotensin react together? Angiotensin 1. Where is ACE released from? Lungs. What happens when angiotensin and ACE react? Angiotensin 2. What is angiotensin 2? Vasoconstriction, increases of sympathetic stimulation, stimulates release of ADH, releases aldosterone. What is aldosterone? a hormone that increases sodium reabsorption in the kidney tubercles and causes potassium excretion. Where is aldosterone secreted from? The adrenal cortex. What does ADH do? Causes the kidneys to reabsorb water. What are two substances that inhibit ADH release? Adrenal natriuretic peptide and cortisol. What substance slows the ADH response? Alcohol. What are the four different classifications of shock? Hypovolemic, obstructed, cardiogenic, distributive. What are examples of distributive? Neurogenic, anaphylactic, septic. What is hypovolemic shock? The body is losing too much fluid that can be external through bleeding or through dehydration. What occurs in septic shock states? The body vasodilates, causing low blood pressure to vital organs. What occurs in neurogenic shock? The body suffers trauma to part of the spinal cord and causes loss of sympathetic tone below the injury site. What are some examples of obstructed shock? Cardiac tamponade, tension pneumothorax, P. What is the common triad that is found in trauma patients relating to shock? Acidosis, coagulopathy, hypothermia. What is the Bohr effect? A physiological effect that relates to carbon dioxide and hydrogen ions affecting the affinity for oxygen to hemoglobin. What is the Haldane effect? A physiological effect that relates to oxygen affecting the affinity for carbon dioxide bonding to hemoglobin. What does the oxyhemoglobin graph measure? The SpO2 and PO2. What causes a right shift? Increase in temperature, acidosis, increase in DPG, increase in CO2. What causes a left shift? Decrease in temperature, decrease in 2,3-DPG, decrease in CO2, alkalinosis. What is 2,3-DPG? An organophosphate created by RBC due to glycolysis. What are the most common sizes of MPAs? 26, 30, 34. How much time would a M-tank on 800 last if you were transporting a patient on a nasal cannula at 4 liters per minute? 1 hour and 17 minutes. What is the suction volume on an adult VAC? 380 mmHg. What is the average weight of a stair chair? 18 pounds. What is the suction volume on an adult Impact 301? 500 mmHg. What does the 6 P's and A mean? Pain, pallor, pulse, paresis, paralysis, Paresthesia, anesthesia. How much time would a D-tank last with 1,400 pounds per square inch while transporting a patient with an NRB at a flow rate of 12 liters per minute? 12 minutes. What is the manual called where you can find details on how to complete ACR according to the ministry? Ambulance Call Report Completion Document Manual. What is the amount of traction you would pull if using a SICAR for a 64-kilogram patient with a single femur fracture? 14. Should you use oversized equipment on children in an emergency situation? No. What is the endocrine system control? Controls the hormonal system. What is an organ that acts as both an exocrine and endocrine gland? Pancreas. What part of the pancreas is the endocrine portion called? Islets of Langerhans. What do beta cells release from the pancreas? Insulin. What do alpha cells release from the pancreas? Glucagon. What causes IDDM? Autoimmune disease.